So tell me exactly what's going on with you.
So I've been dealing with numbness and burning pain down my left leg, my left lower extremity, for the past 5 weeks. It's been consistent to the point where it's causing me to limp. It's burning, it's shooting, and numbness from my glute area down to my back of my thigh to my fourth and fifth toes.
Are you having difficulty walking?
No difficulty walking, but when I do sit for a long period of time, like while I'm driving and then I get out my car, I do start to limp more and I feel like it burns mainly in the glutes, my left glute and then on my left lower extremity.
Okay. So left side is the one that's bothering you, right?
Yes.
Yeah, I can see that you are limping a little bit on this side. Walk one more time, please. I don't know if you know, you are guarding your left foot as you're putting the foot down on your left side. You're babying more on the left side because you're feeling the numbness on this side. Do you still feel the numbness as you walk?
Mm-hmm. Even more so because the floor is cold. Like it's like my outside of my heel and my fourth and fifth, like that area.
And then I don't know if you know, the rate of you bringing up your ankles are also very different between your right and your left foot. Okay. Okay, I'm going to test the individual strength of the toes, okay? I want you to go ahead and push up, please. Push up. I know that you're pushing up on this side, but this side is actually being quite weak here.
It's the left side?
Yeah. Push up. So this is fine. Yeah. This is fine. This is fine. Push down. Yeah, I can see that you're not able to push down as much effectively on this side. Do you notice the differences?
Yeah.
Push down here. I would say it's about 40% stronger on this foot as opposed to over here. Okay. Would you agree?
Yeah.
Okay. Try to push inside. Okay?
In your
yeah, into my hands. So that's about the same. Push out. Oh, you're not pushing at all on this side like this.
Really? I'm trying.
This side is strong, but this side is weak. Push in. Okay. So this can be actually very dangerous for you for a couple of reasons. If you're walking with a lot of numbness to your foot, especially you see you have a little bit of hammer toe on every toes here like this. If you are a patient with diabetes or somebody with any kind of systemic diseases like diabetes, this can become a point where you could be hurting yourself without even realizing it. So a lot of podiatrists are actually adamant and then asking patients to come for evaluations for conditions like numbness and tingling, especially because when you're not feeling your toes, you don't know what the heck you're doing to your toes. So it is important to have examination by foot doctors. So that's one of the things that I do. Yeah, as I'm using my instruments to examine your low back, I see a distinctive reading right here.
What does it say? What does it mean?
It means that there's a nerve dysfunction around this area. I don't know if you know, there's a lot of swellings on your low back area. I can already feel that there's a lot of heat coming through around this area. Pain?
I just felt that, yeah.
Yeah. How about right here?
A little bit, yeah.
Right here, you have a pain, right? So as I'm moving, I'm moving your lumbar, fifth lumbar bone actually. And then you see, as I'm rocking you back and forth gently, there's a little bit of pinching pain at the end of the motion. Do you feel it? And this is your bone called sacrum. Do you notice that as I'm rocking you back and forth gently, you have a pain right here? Yeah. Just want to be able to share the x-rays with you. So this is your spine x-ray taken from the side. As you can see, this is going to be the side of your spine here like this. So why am I showing you this? Just want to be able to let you know that foot problems are not only coming from the foot. More often than not, it's associated with other part of the body. In this case, in your case, it's going to be your low back. I don't know if you can see, but right about here, you see white block, and another white block, and another white block. It represents a vertebrae bone, which is going to be your spinal bone. And little jelly donut things that looking like thing over here is showing up here as disc. So when people say that I have a disc problem, this is what they are referring to. So why am I showing you this for your foot pain? As you can see, your foot problems can be originating from your low back. Here, your low back is significant for your foot. Let me explain to you why. So this is your skeletal system right here. This is the head, and all the way this is our foot. So as you can see over here, the yellow thing that coming out from the spine is called nerve. That's the one that controls the feelings and the movings of your body. And this is ultimate system that controls entire part of your body. So the nerve that comes out from your low back goes down to, as you can see, on your knees, on your legs, even to your foot. But what happens if you have the problem coming from right in this area? This is exactly what's happening in your case. My tests are confirming that you have a problem right here that actually causing numbness to your foot. Okay. And as we are looking into your front of your spine, you can see all the vertebrae are rotating through this way. As you can tell, it's rotating through all through this way. But your L5 right here is only one that's actually on this position. Why is that? Because it's under tremendous amount of stress. So this is a problem, but the actual problem is this, and also on your sacrum. Sacrum is this bone right here, that your tailbone pretty much that you're sitting on top of. Well, tailbones are supposed to be completely fused into one single bone by the age of 23 to 25. But in your case, as you can see, there's still some rudimentary disc over here. What does that mean? So when you're sitting on your foot, when you're sitting on the chair for such a long time, and then you are driving for many hours, this thing can be knocked out. So when you are having a long day in the office, and then when this has been knocked down, all of these things above here is affected. So if the sacrum, which is going to be your foundation of your basis for your entire body, the reason being is because the center of the gravity, if you're walking here like this, the center of the gravity is actually a couple inches after your sacral bone. So this is where your center of your gravity is. So if this gets knocked down, everything here is also knocked out as well too. So the mission of our job today is make sure that we stabilize this. And then everything else will be able to function a little bit better. But we have a little bit of problem on this side. The reason being is because your sacrum right here is a problem, but so is your L5. But those are actually very, very close together, which means that I'm going to have to fix your sacrum today, but this means that your L5 could be flared up. So don't be surprised if you start to feel like, my pain's a little better, but I'm starting to experience some different kind of pains that I never had before. Okay. That's to be expected. The reason being is because if we are fixing this, this is going to be knocked out even more. So once this gets stabilized, then we can only fix this. We cannot do it at the same time because they're really close by together. Does it make sense? This degeneration over here has been ongoing for a while. You have mentioned that this problem has been there for a few weeks and it has been symptomatic for the past 3 years. But this degeneration is significantly more than this one. This I am estimating this has been a degeneration stage 2, and I am sure that it has been a problem since 8-9 years ago. Whatever you have done to your body 8-9 years ago has not been fully corrected, so it has been a problem for a long time. Now it is only showing up as a manifestation as a foot numbness and tinglings and weakness, but in actuality it's a problem in your low back area that needs to be fixed. It's a problem in the low back area that has been showing up as a foot problem. It's a low back problem that needs to be fixed in order to fully correct your foot problem. If you're only addressing the foot itself, you may not be able to get 100% because yes, there are problems in the foot areas also, but more or less, this is responsible for the majority of the problems you're experiencing right now. So this is your foot. Look from the sideways. As you can see, everything is supposed to be in normal and nice alignment, but it is not. Your talus bone, which is the bone right here, is tilted upward. This bone is called calcaneus, which is right here, is tilted downward. What does that mean? That means that your bone is not in perfect alignment. So whenever you're trying to bring your ankle upward like this, you're going to get some block because this bone is not effectively being able to move up and down to assist with ankle going up and then going down. This can also contribute to the cause of you having foot problems in the first place. Also, as you can see over here, this bone called navicular, which is going to be big bone right here, has been dropped down a little bit. So what it means is that because of this bone has been written up to compensate for the problem that has been happening above in the low back area, this bone has to drop down to compensate for the bone problem over here so that you can continue to have a functioning foot and ankle to your body. So as you can tell, this is not a problem that has been ongoing for a short amount of period. This has been an ongoing problem for a long time. This is from here. Bring your belly up.
Bring my belly up.
And then bring it down. Bring it down. Bring it down. Bring it down. Here we go. We got it. Are you okay?
Yeah.
Do you feel it?
I did.
Okay. Okay, push down. Wow, it's much stronger.
Yeah.
Push up. How's the numbness? How much of numbness is gone so far?
It's still there, but not. It's still there. It's mainly on the toes.
Okay. How much of the numbness has decreased?
I'm gonna say like 20%.
Okay. All right.
Oh.
Okay. Let me go ahead and do this side too. Like I said, I'm going to go ahead and do the calcaneus like we talked about before. Okay. Both side calcaneus is done. I'm checking for any kind of a dysfunctions or dismobilities on this bone called metatarsals. Face out, please. Yeah. Do you feel this?
Yeah.
Pain. Wow, did you hear that?
Yeah.
There you go. So tell me what's different.
I feel the pain in my glutes is gone. I don't feel the pain. The numbness is still there, but it's a little lighter.
Like I said, it's not an on and off switch. You're going to start to feel some improvements, but it won't be instantaneous.
Mm-hmm. Yeah.
As you can see, the foot movements are pretty even. Yes, much changed.
Okay, yeah. Wow.
So how much of an improvement do you think in overall that you're feeling?
Overall, yeah, about 70%, like 60-70%.
Numbness?
The numbness is probably still there,
Mm-hmm.
but it's more focal now.
Good job. Like I said, it's one of those things that will take time. It took you 3 years to get to where you are.
Mm-hmm.
It will take time to be able to get the pressure off completely.
Right. Wow.